Hello everyone, welcome to ProMed. Today we will discuss about brain hemorrhage, a very important topic. And also this topic is related to many subjects. So ये topic जो है integrated होके आ सकता है दूसरे subjects के साथ भी, जैसे कि radiology, then surgery और medicine में भी आ सकता है. Frequently इस topic के बारे में FMG exam में पूछा गया है. They will be asking image based questions or they will be asking a clinical based question or one-liners. So we will look into all the points now, one by one. One important question frequently asked is initial or the investigation of choice if a patient presents with a head trauma. तो head trauma का patient जब भी आएगा तो हम कौन सा investigation first करेंगे? So it is NCCT, non-contrast CT scan. This non-contrast CT scan हम सबसे पहले करेंगे when a patient presents to the emergency after having the head trauma. तो देखो क्वेश्चन वन लाइनर के फॉर्म में भी पूछा जा सकता है और दे कैन आल्सो गिव अ क्लिनिकल केस कि एक ट्रॉमा का पेशेंट था, अ पेशेंट प्रेजेंटेड टू द इमरजेंसी आफ्टर ट्रॉमा एंड ही वाज अनकॉन्शियस. व्हाट इज द इन्वेस्टिगेशन ऑफ चॉइस? इस केस में हम लिखेंगे इन्वेस्टिगेशन ऑफ चॉइस वाज NCCT, नॉन कॉन्ट्रास्ट सीटी स्कैन. देन ये आप देख सकते हैं इमेज ऑफ अ CT स्कैन शोइंग एक्स्ट्राड्यूरल हैमरेज. हाउ डू वी कम टू नो दैट दिस इज अ CT स्कैन? वी कैन सी दैट द बोन हियर इट इज वाइट इन कलर. तो जब भी एकदम वाइट कलर हमको दिखेगा देन वी कैन अंडरस्टैंड दैट इट इज अ CT स्कैन. स्टार्ट करने से पहले लेट्स सी अनदर पॉइंट कि CT में हाइपरडेंस शो करेगा जब भी हैमरेज होगा, हाइपरडेंस या फिर हाइपोडेंस शो करेगा. हाइपरडेंस मीन्स कि तो जो ट्रॉमा हुआ है दैट इज acute trauma. जैसे कि हम देख सकते हैं यहाँ पर हाइपरडेंस वाइट है. And hypodense means it will be a little dull, more towards the black color. And if there is hypodense lesion present, then it is suggestive of chronic. So let's start our discussion about the brain hemorrhage one by one. तो पहला है EDH, extradural hemorrhage, also called as epidural hemorrhage, also called as epi. The most common cause of the EDH is trauma. Usually we will be having a patient presenting to the emergency after having a trauma or fall. Okay. Then the site of the bleeding, कि bleeding कहाँ से होती है EDH में? So the artery which bleeds is the middle meningeal artery which is bleeding. And site कहाँ से ये bleed करता है? तो middle meningeal artery bleed करता है एक site टीरियन से. जब भी there is a fracture to the टीरियन, injury to the टीरियन, वहाँ से middle meningeal artery से bleeding हो सकती है and वो present कर सकता है EDH की तरह. Let me show you the image of the टीरियन. So this is a terion and formed by the joining of the four muscles. Here lies the middle meningeal artery as you can see here. तो जब भी आप इस यहाँ पर फ्रैक्चर होगा तब मिडल मेनिंजियल आर्टरी से ब्लीडिंग हो सकती है. तो दिस कैन बी आस्क्ड एज इमेज बेस्ड क्वेश्चन इंटीग्रेटेड विद द एनाटॉमी. सो ये इमेज भी बहुत इंपॉर्टेंट है और ये क्वेश्चन की तरह पूछा गया है पहले. लेट्स कंटिन्यू. इसकी एक जो बहुत क्लासिकल फीचर है EDH की दैट इज ल्यूसिड इंटरवल. Lucid interval means the patient is conscious, is conscious, becomes unconscious, and again regains consciousness. So this is called as lucid interval, and a very important point. PYQ आ चुका है, already being asked in the FMG exam. Then on CT scan, how do we see it? On CT scan, we can see it will form a lens shape. So this is called as lens shape, or also called as spike on wicks. Asked as a one-liner, as a clinical based. So it is very important to know each point of this EDH, epidural hemorrhage. Now moving forward, we will discuss now about the subdural hemorrhage. Most common cause is trauma. The bleeding vessel in the subdural hemorrhage is reaching waves. And on CT scan, this shows a crescent shape, like this. We see it a crescent shape. So on CT, it looks like a crescent shape. इमेज बहुत ज़्यादा ज़रूरी है बिकॉज इमेज बेस्ड क्वेश्चंस भी पूछा गया है. देन मूविंग ऑन टू सबअरेकनॉइड हैमरेज. सबअरेकनॉइड हैमरेज का भी मोस्ट कॉमन कॉज है ट्रॉमा, बट देयर इज आल्सो अनदर कॉज दैट इज हाइपरटेंसिव, आल्सो सीन इन द हाइपरटेंसिव पेशेंट. जब बीपी बहुत ज़्यादा बढ़ जाती है तब ये देखने को मिलता है. द मेन सोर्स ऑफ ब्लीडिंग इज द सर्कल ऑफ विलनेस. सर्कुलर फिल्डिस में पेरी एन्यूरिज्म बन जाती है, जो कि बहुत डेंजरस कंडीशन है, और वहाँ से ब्लीडिंग होने लगती है. And whenever there is a bleeding, we can see on CT star of death-like appearance. Can you see the star-like appearance? So this is a characteristic CT finding of the subarachnoid hemorrhage. Then देख सकते हैं इस patient में. Okay, and another very important clinical feature of this is that the patient will be having severe headache. The patient presents to the emergency with a severe headache, and he may give the example of worst headache of my life. And this headache is called as thunderclamp headache. The next type is the parenchymal hemorrhage, and the most common cause of the parenchymal hemorrhage is the hypertension. And the most common site of bleed is the putamen. Putamen is the most common site of the bleed. In the CT scan, we can see a hyperdense area in the putamen, and radiology में image-based question के form में पूछा जा सकता है. So ये भी एक potentially important image है. The question can be asked that the hypertensive patient coming to the ER with complaints of weakness in the arm, progressive weakness in the arm, and CT scan is given. So what is the diagnosis? So the diagnosis will be the parenchymal hemorrhage or the putamen bleed. Then another kind of hemorrhageal bleed. Another type of brain hemorrhage is the intraventricular hemorrhage. That is hemorrhage in the ventricles. As we can see that there is hypodense fluid present, hypodense area present in the ventricles. So usually the CSF on the CT scan shows black color, but here there is a hyperdense area suggesting of hemorrhage. Not a very important question from exam point of view, but just for your knowledge sake, I have covered even this in the video. So these were some important points related to the brain hemorrhage asked in the Fmge exam, and I suggest you to go through all the points very clearly and also look at the images very thoroughly, because one question every year is being asked from this topic in the Fmge exams. Thank you guys, that's all for today. If you liked the video, please subscribe to my channel and also share with your friends if you like and find my content useful. Thank you. Bye-bye.